Abbreviations are commonly used in healthcare to improve efficiency in documentation. However, some abbreviations can be misunderstood and lead to medication errors. The Joint Commission created a Do Not Use list of abbreviations that should not be used in any healthcare facility. Examples include QD once daily, mistaken for QID 4 times daily, U, unit, mistaken for 0, 4 or cc, trailing 0 x to a milligram. Decimal point could be missed, lack of leading 0.x milligram, dose 10 times lower than intended. Priority questions are used during patient assessments to quickly identify actual or potential threats to life, limb, or eyesight. Examples include airway, is the airway patent or at risk of compromise? Breathing, is the patient short of breath, showing signs of respiratory distress or at risk for hypoxia? Circulation, is there abnormal heart rate, rhythm, or blood pressure? Signs of poor perfusion? Neurological deficit, any sudden onset of neurological signs, symptoms? Level of consciousness? Is the patient at risk of harm to themselves or others? Are there any other emergent issues or threats to life, limb, eyesight? The nursing process is a systematic method used to provide excellent care. It involves 5 interconnected steps. 1. Assessment. Gather information about the patient's health issue, medical history, symptoms, etc. 2. Diagnosis. Analyze assessment data to identify actual or potential issues the nurse can intervene with. 3. Planning. Create patient goals, outcomes, and a nursing care plan for treatment. 4. Implementation. Carry out nursing interventions, coordinate care with team. 5. Evaluation. Determine if desired outcomes were achieved, modify plan as needed. The nursing process requires critical thinking to determine appropriate interventions tailored to each patient that will improve health outcomes. When answering priority assessment questions, the goal is to rapidly identify emergent threats that require immediate nursing intervention. Tips to answer effectively. Ask close-ended questions that require only a yes/no response. Listen and observe closely for distress signals. Use active listening without interrupting the patient's medical history. Watch for nonverbal signs of pain, respiratory distress, etc. Perform hands-on assessments, checking airway, breathing, circulation. Double-check vital signs and monitors for red flags. Communicate clearly if you need to take emergency action. Maslow's hierarchy identifies key needs that impact human health and life. It prioritizes needs from basic physiologic needs to higher psychosocial needs. 1. Physiologic needs: oxygen, food, water, temperature regulation, sleep. 2. Safety security needs: safe environment, employment, resources. 3. Belongingness needs: relationships, intimacy, family. 4. Self-esteem needs: respect, recognition, confidence. 5. Self-actualization needs: achievement of full potential. Unmet lower-level needs will dominate perception and behavior until fulfilled. Nurses apply Maslow's theory by prioritizing care based on assessment of which core needs are unmet. Ethical nursing practice demonstrates compassion, integrity, and duty to patient well-being based on codes of ethics from nursing organizations like the ANA. Key aspects include autonomy, respecting patients' rights to make own health decisions with informed consent. Keep patient information confidential. Beneficence, promoting good for the patient by preventing harm and maximizing benefits of care. Non-maleficence, first, do no harm principle. Avoid performing interventions with greater risk than benefit. Justice, fair distribution of care, resources, and access without discrimination. Advocate for vulnerable patients. Nurses have additional ethical and legal obligations outlined in state nurse practice acts and must follow workplace policies to avoid litigation. Nurses play a vital role in preventing infections by maintaining safety precautions in healthcare environments. This includes hand hygiene, thorough washing before/after patient contact using soap and water or alcohol-based hand sanitizer. Use proper technique. Personal protective equipment, PPE. Wear equipment like gloves, gowns, masks, and face shields based on risk for blood, body fluid, or hazardous drug exposure. Transmission-based precautions. Use additional precautions tailored to the patient condition in addition to standard precautions. Contact precautions. Direct contact with patient or contaminated surfaces. Droplet precautions. Coughing, sneezing, or procedures that aerosolize saliva. Airborne precautions. Highly infectious particles suspended in air. Types of precautions dictate what PPE is indicated and any special patient placement or transport procedures. Infection control prevents development and transmission of infections in healthcare facilities. Critical aspects include personal protective equipment (PPE), hand hygiene before/after PPE use, gloves, sterile and non-sterile, isolation gowns, full coverage of skin clothing, masks, N95, surgical, face shield, safe handling, disposal, and placement of contaminated PPE. Infections progress through several stages as pathogens enter, multiply, and damage cells and body sites. Incubation period, exposure to pathogen before signs, symptoms appear. Prodromal stage, early nonspecific symptoms like malaise, illness. Pathogen rapidly reproducing with worsening symptoms. Decline, pathogen runs out of cells or immune response catches up. Convalescence, slow return to health. Transmission-based precautions, contact, direct skin contact or contaminated surface contact, droplet, coughing, sneezing, or procedures that aerosolize saliva, airborne, tiny infectious particles suspended in air long distances. Matching appropriate PPE to the method pathogens are transmitted prevents spread between patients, staff, and visitors in healthcare settings.